Oh, ain't nothing wrong, okay?
Hello, everyone, and welcome to another episode of Black Scientists Cooperative. And today we are talking about patient advocacy. We're continuing our discussion from talking about from the patient perspective, and now we're going into what our healthcare providers' perspective is on patient advocacy. And we have a special guest here tonight. We're so glad to have Dr. Calvin Smith. He is our Maharian brother, so we are so excited to have you here. Thank you, Calvin, for joining the episode.
Thank you.
To kick us off, can you just give us a little bit of a background about yourself? Tell us, what you're doing and kind of how you got there.
Sure. Thank you guys so much for having me. I love to see these beautiful Black women talking about science. This is really exciting to me. I am originally from Atlanta, Georgia, born and raised. I went to Westlake High School. I was in the magnet program, the math and science magnet program there, graduated and then went to Morehouse College. From there, I went to Meharry Medical College where I met you lovely ladies, and I trained in medicine. I went on to do an internal medicine residency training and stayed after that was done and did a chief resident year and joined the faculty. And now I'm on faculty in my positions right now. I am the clerkship director for the internal medicine students. So every student who comes through internal medicine has to deal with me one way or another. And I also am the dean of admissions or assistant dean of admissions. So I get to see every person who comes through Meharry in the School of Medicine. And then finally, I'm on the board of health here in the city of Nashville. So I'm doing a bit, but I'm really enjoying myself.
Very nice, very nice. Calvin, so in our initial episode, we talked to a patient, right? And she walked us through a story about how she had to advocate to get equitable health care. Can you help our viewers to understand how physicians feel when patients advocate for themselves or for their family members? Because a lot of times I think people are afraid to ask questions or push back, if they don't agree.
Sure. Well, first and foremost, I want to say there's two schools of thoughts. There's a right way and a wrong way. And the way I was trained is what I feel is the right way. I'm happy to have any patient to ask questions. As a matter of fact, I want my patients to be educated. That's a big part of what I've been trained to do and what I'm training my students and residents to do. I feel as though when patients advocate for themselves or have someone to step in as an advocate for them, they get better care. They are not just better care for me, but they take care of themselves better, which is the ultimate goal. So I'm not intimidated by it. I'm not upset by it. It's not a waste of my time. If someone is coming in with questions, even if the questions are not quite in line with what we are thinking, it still shows me that this is somebody that is informed and cares about their care. So I like to see it. But to that point, I think that depending on where you were trained and what you brought into training, because it's not always about where you were trained. Sometimes it's about what you brought into it. I think that some people have to shut down their egos. I think ego is the biggest obstacle to advocacy. In other words, my opinion is the biggest opinion in the room, is the best opinion, the most informed opinion in the room, and that's it. That's it, and that's all. And the way I was trained and the way that I train, that's not acceptable. I'm teaching my students and my residents to always be thinking about the differential diagnosis and think about what could be, and to accept that and to inform their patients and then have their patients reflect that back to them so that they understand what's going on.
And so with that, and just thinking about how you just described you feel as a patient, there are certain things that certain ethnicities or races or genders deal with in terms of stereotypes, right? So in the same episode that Mila just mentioned, the guest, she is a doctor, a PhD. Her husband is an MD, but because she is a Black woman, even in that situation that she was in, she was advised by her own husband to not say certain things or to say certain things so that there wouldn't be a perceived perception of her motivations for coming to the urgent care at that time. So my question to you is really, what advice would you give to patients in these kind of situations who are trying to advocate for themselves, but at the same time are sort of against certain stereotypes and biases? So what would you be the best approach for that?
Well, it's unfortunate that in 2021 we're still dealing with these kind of things, but the reality is that we are. And so, I treat it a lot like I treat, and I hate to be this way about law enforcement, but the way that I deal with law enforcement encounters is to kind of assume that people are going to make a decision based on how you look. Unfortunately, that's how things are. And so with that being said, you also have to realize that these doctors, these nurses, whoever you're dealing with, they are also still human beings, just like you are. So there should not be, even though you are fearing for your life, you know what I mean? You have to bring that extra equation in and not have fear of these people, so that you have a voice for yourself. You know what I mean? If you are fearing these people and fearing their position, you kind of just take what they say at face value and don't question it. And we've been taught to do that, taught to be deferential, all these kind of things. And I think that sometimes that's the wrong tack to take. I think that, you should view those people as a human being with a job, just like you, and your body. And so I always advocate for my patients to let people know and to listen to what they say. I tell my students, you have 2 ears and 1 mouth. So listen twice as much as you talk. Listen to what your patients are going to always tell you what's going on. They might not say it in the way that the textbook said, but they're going to say what's going on with them. And so with that being said, as a patient, I tell my patients, look, you have to let people know how you're feeling and make sure that you have an understanding about everything before you leave this hospital, before you leave this room. I always ask a patient, what do you know about what we just said? And I think that's a good question to ask someone, because they're going, they can't nod their head and be like, okay, I got you. They have to actually reflect back what they understand. And if there are gaps there, we can fill those gaps. When they leave my care, I want them to, when they go to see a specialist, for instance, I give them specific questions to ask. And I try to make sure that they have somebody. If I've noticed that, for instance, they don't always get everything that we want to say in the encounter, I ask them to bring somebody with them that they feel like they can trust and that they can advocate for them. But I want people to be armed with education and appropriate to their level, because not everybody spent a million years in school like I did. You know what I mean? And that's okay. That's perfectly fine. But when it comes to your health, there's a certain amount that you need to be responsible for. And I like for my patients to take that ownership and recognize that it's a team approach. I can only do so much. And I can, I'm pretty good at guessing some things, but I'm better when we have a dialogue. And so breaking down those initial barriers, and talking to their physicians and the other people around them like they're people too, because they are. And, people will, to an extent, people will get away with what you let them get away with. And so, hold these people accountable. I hear stories all the time in medical groups about patients, how they feel when patients say, well, I want you to put that on record. And a lot of people are intimidated by hearing that. But for me, that's fine. I'm gonna put it on the record, because I feel like whatever I'm doing is meeting the standard of care. And if it's not meeting the standard of care, then I need to, not the patient, but I need to reevaluate and see if what I'm saying is truly that I'm not falling a victim to bias, falling a victim to kind of underestimating what my patient knows, et cetera. I always like to, meet people where they are. And if that takes a little bit more time, then that takes a little bit more time. But a lot of physicians, are in a situation they feel like, their time is more valuable than that. And unfortunately, you have to make people aware when you're the patient that, you're the bottom line. And whether that's in the room there or later in a deposition, somewhere along the ways, the patient needs to be made the forefront. That's really why we should be doing what we're doing.
So I'm sorry, Maya. Go ahead.
No, I just wanted to chime in on that for a second, because that's how you move past the intimidation factor. One, understanding that, the physicians are human too, to understanding that whole bottom line piece. Like, really, this is like a services industry. And so, if this were banking or if this were goods and services and you weren't getting the level of customer service that, you felt you should get, people would be coming out of bags. Okay.
Yeah.
So you need to like come out of a bag with regards to your health care and ask questions because it's really the same thing. It's a service. It's a service. It's healthcare service. And you're paying for it. It doesn't probably doesn't feel like you're paying for it when you go to these visits and things because of the whole concept of insurance, but you really are paying for it.
And I like to kind of touch on some of the things that you were saying, Calvin, about you've used the term you was taught this, and this is the way that you care for your patients. How much of that is just your own individual personality versus you were trained to handle and be as attentive as you are with with your patients?
I think it's a good, healthy mix of both. If I'm being honest, I would say it's about 75% of my training, 25% of the way I was brought up. I certainly, and one of the things that I keep in mind on the admissions tip is looking for students that have some of these qualities and bringing that out of them in the interview, really talking about some of their experiences dealing with the Black community, dealing with other communities outside of the Black community, because that matters too, and how they react to what kind of patience they have with teaching. I'll put it that way. I'm not always. Today I had some bad instances with some patients, unfortunately. Where I was not patient enough. I didn't try enough. So we all fall short. And I certainly don't. I hold my students to a high standard, but I don't hold them to a higher standard than what I hold to myself. So I have to be real about that. But yes, I think that my training really played a significant role in it. In the fact that we have to take courses at Meharry that are around health disparities, that are around recognizing how to talk to people, how to approach people. There are certain aspects of bedside manner that can't be taught, but there are some aspects of bedside manner that can be taught. And I think that sometimes, even in dealing with students that have been very successful in the sciences, a lot of times they are in their shells. Their interactions with people are not always the best. I'm trying to be delicate about how I put it. They're not always the best people, you know what I mean? And so sometimes you have to teach them to be aware of those things, like, to make them aware of habits that they may have that are breakable, and try to work on those things. And so that's where training comes in. And for me, in my part, I had a really strong village, a very strong background at home. My mom was, my parents got divorced. I don't want to say that she was totally by herself raising us, but she did a great deal of it on her own. And it was me and my two sisters. And my two sisters are both in academia, have gotten PhDs. One is teaching at North Carolina Central. The other uses her biostats PhD for other work. But I say that to say my mom put education as one of the big things for us, but she also taught us to be, respectful people, to be polite, to recognize. And my dad also played a big part in recognizing our name, our family name, and knowing who our relatives were and knowing what they had done. And so we had pride in that. And we didn't want to go out and embarrass, cousin Jane, cousin Clint. We didn't want to go out and embarrass these people by acting a fool. And so, we valued our education. We valued treating people properly. And I did bring a lot of that into my training.
Great. So you also mentioned the term health disparities, which kind of brings us to our next question. What is your perspective on the role of patient advocacy in eliminating health disparities in the Black community?
Well, as it stands right now, it's essential because there are so many people that have been trained in ways that ignore health disparities, the I don't see color type of people. That feel like everything is equal when it's not, that confuse the terms diversity and inclusion with equality, which the three terms are not the same. And so, we have to have somebody to advocate. And when as it stands right now with the disparities, starting from the beginning, how the schools, basically school to prison pipeline works, and how our children basically they start off on the wrong foot in terms of how they are treated, and so on and so forth. So how it goes, we have to have somebody to advocate, and to kind of break down these walls between the patients and these people who hold the job of doctor, nurse. Because, and I want to be real specific about saying these people that hold the job of doctor and nurse, because they're still people, And so having somebody to advocate who knows a little bit about what's going on, who has a background and has the ability to communicate with these people, to make sure that if there are some things, some $1 million words that be thrown around, that you understand and come out of that meeting with an understanding of what's being said, is important to trying to bridge that gap, for the time being. Ultimately, I advocate for self-empowerment, and I want us all to get to the point where we can advocate for ourselves. But you have to be realistic with the way that the healthcare system is set up right now. The encounters are expected to take 15 minutes. They are, people are, the work that we do is advanced. And so people don't have, quote unquote, time to break down everything that they say they're doing. And so those advocates serve that role of really using that time efficiently and saying, hey, look, you use this term, just explain what this term means. A lot of times physicians are ignorant to the fact that they're using terms that people don't know. They get so used to talking to their colleagues and their buddies and people who are educated. And they just talk and talk and talk at people and not with people. They talk with the intent to get a reply, as opposed to talk to understand and to have a dialogue. And so until that happens, advocates are absolutely necessary for our community, for Hispanic communities, for anybody who is Black, not just Black females, but especially Black females. But, well, actually, I take that back. It's mostly Black females, because white females tend to get catered to. And that's, unfortunate. But, Black females in textbooks, there are still passages in OB books about Black pain thresholds and how Black females can take more pain than white females. So you're fighting against those kind of things too. And so for sure, advocate who can say, well, what you read in that textbook is false. And, my patient or your patient has the same threshold for pain as any other person, and needs the same level of care and questioning that anybody else needs, and then needs the same level of attention that anybody else needs.
So let me ask you this, because you've got a lot of things going on in this advocacy and patient standing up for themselves and mitigating health disparities. So I kind of want you to break down, how does specifically physician training, how can that mitigate those disparities? How can we bridge that gap and decrease the incidence of that?
Sure. Inclusion is the biggest part of that. Inclusion in all aspects of training. So it's not enough to admit a certain percentage of Black students. It's not enough to graduate a certain percentage of Black students. You need to be promoting these Black students into your workforce and having them involved in the training. You need to have real patients come in and talk to the students while they're training, so that they have an understanding of what it's like on that end. Far too often people have to experience things. We're seeing this with COVID. They have to experience it before they understand the reality, the gravity of what they're dealing with. And so that the same holds for medical students and trainees. They need to have some skin in the game. They need to be a part of the conversation, but they also need to have these voices and hear from them, and not just hear secondhand or third hand about Black people and their experiences, but actually talk to and get to know Black people. And that goes into the training, that goes into their professors, that goes into, all aspects, the 360-degree evaluations. All those things need to include African Americans and their experiences, and getting to know them as people. That's not to say this is not going to squash all racism, because, a lot of racism is inbred and inborn. But certainly a lot of reasonable people who would feel that they, are just ignorant, that removes that barrier, and then it's on them. then they can make a conscious decision to be someone who makes a bad choice, as opposed to somebody who didn't know and makes a bad choice.
So in that same light, and having the training and making sure they're doing those 360-degree evaluation, how are we, I guess, combating some of that ingrained bias or that implicit bias that people bring to the tables when they enter a situation?
It starts with training, but it has to continue with a conscious effort on the part of the trainees. So, again, unfortunately, the way things are, you kind of have to, for some groups, you have to incentivize it and have to make it worth their while to do so. And there are ways of going about doing that. But I think that ultimately those kind of ways tend to build resentment among the people that have been trained. So you have to be careful about that. I think just exposure to and elevating people who are experts in the field, who are African American, and having them as a constant voice and face, and not punishing them for being who they are. You look at a situation in Tulane where there was a faculty member who advocated and was a strong advocate for the trainees and things of that nature, and she was treated poorly and ultimately let go by Tulane's program. And stories like that have made news and have made a lot of headlines and have entered into the public consciousness, so people are aware of that. And unfortunately, you hate to see stuff like that happen, but it also, the silver lining of that is that it makes people aware that today these things still happen, and any example of things like that have to be made known. It's not medically related, but I look at the doctor, what is her name, in North Carolina, who ended up going to Howard, but her story, making people aware that these things are happening even today. And that until our voices are respected and equal and wanted and not just tolerated, that these things are going to continue to happen. So we have to fight for not just being tolerated, not just included, not just that diversity token, but being inclusive and being equitable, having equitable stakes in the game. Equity is the name of the game throughout. And until we get these Black program directors, Black deans of schools, Black heads of training programs, it's going to be negligible. But we have to put these people in place, and we have to support them and allow them to kind of through osmosis, or however you want to put it, allow what they do to seep through into the trainees. And ultimately, we're still gonna have some bad apples out there, but the good apples will not only outweigh the bad apples, but they'll be empowered to speak against those bad apples and get them out of there. I always tell my trainees, I don't want them to be like, and again, I don't, no disrespect to good cops out there, but I don't want them to be like the quote unquote good cops that tolerate these bad cops. In the medical profession, we don't allow that. If you see somebody doing something wrong, you have to speak out against it, whether they are impaired in terms of sexual harassment, impaired in terms of the way that they approach Black patients, whatever the case is, recognizing that they are impaired and doing something about it, having a voice to speak up about it. And a lot, so being advocates, as it were, for yourself, even as a trainee, and saying, hey, look, what you're saying is not right. Being able to approach your colleague that's a resident with you or a senior resident and say, hey, the way that you treated that patient was not equitable. It was not fair. You did not spend the time that you would spend with another patient. And I think you should be aware of that. And I think you should try to work to be better about that. So, everybody has stakes in it. Everybody has skin in the game. And if you don't have skin in the game, you should. And that's where it all starts to me.
Awesome. So what would be your, nutshell take on how do we bridge the gap for those of us or physicians that weren't trained in a HBCU situation, who didn't have that Meharry, background to teach them that, or come from our community? So how do we kind of take their implicit bias, their ingrown and, nature of having those insensitivities, and what can we do to make sure that we're bridging, their patient and how they're caring for their patients?
It's really tough because especially as a trainee, you feel already like that things are against you, that you can barely advocate for yourself in terms of like taking a day off. So when you see injustices occurring, it's really difficult. So what I usually encourage my students before they leave, I like to sit down with a few students before they leave and go out to the quote unquote real world and tell them to pick and choose their battles wisely, but to get someone that they trust as an advisor, a strong role model in their community, be it a physician, or it could be a nurse, it could be anybody that they feel like they can confide in and trust. And first and foremost, establish a relationship with that person. To have that person who is in a position, a better position to fight their battles for them, to fight those battles for them, to get to know the system that they are going to know what the rules are for HR and what the environment is towards like hostility, towards retaliation and things like that. And, kind of know the background of where they're going first before they fight a battle. And I always like to make sure that my students understand their first priority is to finish their training program, and I tell them, don't be a sucker, don't be an Uncle Tom, whatever the case is, but at the same time, don't jeopardize your ultimate position for, don't make yourself a martyr if you're not ready to be a martyr. You know what I mean? And some people, to their credit, are in fact prepared and able to do that. And I'm happy for that. But, the vast majority, it takes a lot of bravery to do that. And the fact of the matter is, a lot of people are first generation, trying to go out and make their people proud. You know what I mean? And so they don't want to be derailed by, nor should they have to be derailed by something like that. So, I always tell them to pick and choose their battles and have somebody advocate for them and fight for them. Advocacy is very much, I think we need to kind of think about it as ingrained as we think about how we do our trainees, how it's an apprenticeship, you know what I mean? And really put some of that on the shoulders of those people that have less to lose or might have a little bit more stake, that they have a firmer ground to stand on, and to recognize that. And that's hard. It's easier said than done, for sure. But I really try to make sure that my students understand that before they leave, that there's a lot riding, whether, it's a lot of pressure, but there's a lot riding on what they're doing. And so you can affect more change the higher up you go. And to that end, don't lose sight of where you were. If you saw a problem while you were training, keep that in mind and, address it how you can address it, but get your ultimate goal taken care of. You know what I mean? And then circle back to it and train people in the way that they should be trained. Black, white, whoever. Train them so that they don't make those same mistakes that other people make. We have to get into this old boy network and sneak in there and kind of root it out from all aspects. We have to flank them. We have to infiltrate. We have to use all those little military terms, right?
Molly was just talking about that.
Yeah.
We were literally just talking about that earlier today.
And everybody has a different role to play. You know what I mean? Like not everybody, some people
Wow.
are by nature just going to be quieter. You know what I mean? But that's fine. It takes all types, but you have to still be able to confide in somebody and let people know about it and let people advocate for you. If you don't feel comfortable doing it, allow them to use their judgment to advocate for you. You know what I mean? There have been situations where I've known about something for a student and I've sat on it for a little bit of time as needed, and then come back to it when things have cooled down, when that student is out of the fray, or maybe when the student is out of there, and addressed it then. And been like, look, I'll be real with you. There's a situation that I've been made aware of in our hospital where there's a physician that comes out of pocket, talks kind of crazy to our students. I'm aware of it, you know what I mean? And I've made my department chair aware of it. So that's the first step for me. Second step for me is to, I'm gonna see how it plays out, but I'm gonna address it, because I'm at equal standing with that person. And that's not, it's not cool. I've noticed that person says things to women of color, and I'm sensitive to that. You know what I mean? Like, we are looking at what is happening with Simone Biles. Look at what's happening with Naomi Osaka. You know what I mean? Women that have stood up for their own mental health have made a decision that is contrary to the public narrative, but it's looking out for their own good. And they receive backlash from the likes of Clay Travis and from these white mediocre white males. The white capitalist patriarchal society. Like, I'm not here for it. You know what I mean? And so with that being said, you have to stand up for those that don't have as much power as you have. And then you have to empower them. So it's not enough for me to just say what I have to say, but I have to put them in a position that they can then fight for themselves and support them, not after the fact, Not after the meeting's done, like, man, sister, I'm sorry, blah, blah, blah. But, say something in the meeting.
Yeah. Yeah.
Say something right then and there.
Calvin, you are talking some stuff tonight.
We have to recognize that we are all in this together. We are all in this together. And, especially like, I see so many of my young brothers and sisters that work so hard to get to where they are, that have made sacrifices, that are, single parents, that are, first generation college graduates, some that are multi-generation college graduates, that, are trying to find their voice out here, trying to impact some change, trying to use what they know for good. And they get snuffed out. They get somebody to tell them, you're overthinking it. You're doing too much. No, the way you feel is valid, and they should feel comfortable. And I hope that if the students don't feel comfortable coming to me, that they feel comfortable coming to somebody. I think one thing that's really good about Meharry is that there are multiple examples of Blackness at Meharry. We are not a monolith. We know that. You know what I mean? And some students are not going to feel comfortable coming to me, but they're going to feel comfortable going to Dr. Benjamin. They're going to feel comfortable going to Dr. Collins, to, all these different examples, Dr. Forbes, all these different examples of African-Americans that have achieved. And so, unfortunately, Meharry and Howard and Morehouse School of Medicine and places like that are kind of like islands in the big sea. So we have to infiltrate. We have to get into these other places. I'm glad to see diversity programs at places, but I'm much happier to see inclusion and equity programs. You know what I mean? And until that language starts to permeate, until we get past just recognizing implicit bias, but addressing implicit bias, because it's not enough to just recognize it and say, hey, we got implicit bias in our culture, and we're aware of it. Okay, what are you doing about it? You know what I mean? And I think a lot of African Americans in academia are tired of being the ones to teach people how to act civilly. You know what I mean? They're tired of being the ones that have to say, look, what you did was wrong. We kind of want, our colleagues that are aware to have some skin in the game. And, we're seeing, I see it sometimes. I don't see enough of it. And so that's kind of where we are now, and there's a lot of pushback from the establishment, and as it should be. If I was established, I wouldn't want people to take over what I'm doing. You know what I mean? I would feel threatened too, but guess what? We here, and we have something to say, and we are valuable. Our lives matter. And so we're not going to go down without a fight. And so that's where advocacy, comes in. So those that can should, and those that can't should learn how to until we get to the point where we can, we can do that for ourselves.
Amen.
Yeah.
Amen. Amen. Amen.
Amen.
Kevin came on here and preached an entire
sermon tonight.
Yeah.
Hey man, it's about love, and so I was looking at one of my memories on Facebook, and I said not too long ago, you don't have to have a sister or a mother or someone you care about to care about women as people. You know what I mean? Yeah. And I think that we have to understand, and I'm just using women as an example because there's so many ways that Black males, when you feel like you don't have power, when you finally feel like you do have power over somebody, you like to kind of exert that power over them. You know what I mean? So we use the example in psychiatry, kicking your dog, going home and projecting on that dog, kicking your dog. You know what I mean? And we have to unlearn those kind of things. We have to learn to love one another and protect one another and recognize the strengths that we all have with one another. And we're not gonna all get along. We're not gonna all be friends, but we all need to respect each other at the end of the day. That's what it's all about, respecting people as human beings. If you took the job as a physician, you took an oath to not cause harm to people. And you have to recognize when you are causing harm, whether you intend to or not. And then once you recognize it, you have to do something about it. You're obligated to do something about it. It's not enough to recognize, hey, I'm a toxic person, but I'm just this guy. So I'm gonna just be this way without my coffee. If I don't have my coffee, I'm just gonna cuss everybody out. No, you have to own that and be like, and I'm talking to myself a little bit here too. You have to own that. You have to own your behavior and recognize that what you're doing is not right, and try to be a better person every day.
That's it.
Yeah. I love all that. I mean, you said a whole lot. And I can resonate with a lot of what you said because being at a Black women's college, we fight against that all day long, and they fight against it all day long, and trying to help them learn how to navigate it. It is a struggle. And just like you take it seriously because they don't know it yet, but they don't know that outside of those gates is a harsh, cold world against women. They read about it, talk about it, they discuss it, but they haven't yet really experienced, what it's like to be a Black woman in this world. Mm. And trying to get them to the stage where to get them to you, right, is the same struggle that you have, that you see with your own students. So I feel everything that you just laid out for us just now, really. So one thing we could clearly see just from this conversation that we're having with you is that medical education and medical training still has a long way to go. Yes. To address a lot of the things that we struggle against as patients, as in you as a healthcare provider. And so the people who are already in it, right? Like your peers that are already in it, have gone through this training. How do you help them fight against what has been ingrained in them in their medical textbook, in their medical training, right? So these are people who have already gone through this system and, are now practicing. So they're beyond you, but are your peers. And they might practice in a Black community. What would you say to them, or how do you approach them? And I think you touched on this a little bit, but how do you now help your peers see their bias and overcome their bias, or at least attempt to at the minimum?
So the first thing I have to do is really be an example. I really try my very best to always be an example to how to approach all patients, but especially my patients in the African-American community. And so, if I recognize in a colleague, for instance, they have a savior complex or something along those lines, I try my very best to gently make them aware of that complex and, try to make them aware of the unintended consequences of some of the things they might be doing. And it's dangerous. Don't try this at home. Not everybody can do it. But you definitely, recognition of it and trying to get them to be aware of it is a big part of it. And sometimes it doesn't work. Some people are just, some people just aren't aware. And so sometimes you just kind of have to step in, and fix situations when you can, and be there for damage control when you can. But I really do try to, especially if somebody's amenable to it, that has, quote unquote, good intentions. Because, a lot of times people feel like what they're doing is righteous and good. But just to make them aware that, look, these Black people that you're treating are not, not uneducated. They're not, they are not, your missionary work. You know what I mean? They are patients who care about their health and their bodies and getting back to a normal way of life just as much as you, who ultimately just want to be able to do the things that they enjoy at the end of the day. You know what I mean? They want to be able to go on vacation with their families. They want to do have the same goals, the same things that you have in mind. And so don't treat them as if, you're here to save them. Instead, treat them as if you are here to help them live their best life, which is a different thing altogether. You know what I mean? Saving somebody, having a savior complex and feeling like, oh, these poor Black people here in this community, I'm doing so much to help them. People recognize that. They recognize when they're being pandered to, and then when they're being talked down to. And sometimes they don't get the intended response. And so they feel like the patients are rude to them, or their perception anyway is that the patients are rude to them. And really, they're just giving them back that energy that they gave. You know what I mean? So making them aware of that energy exchange and saying, hey, like the way that you talk to people, and I wouldn't say it this way, but, making people aware of the way that they talk to people, and saying, maybe this approach, I've seen in the past, this approach works a little bit better. So maybe try to say this or do this, sometimes it's difficult, you know what I mean? Because these people are adults too. And you certainly don't want to, you're going to get a lot of pushback from them because they're highly educated and, you know, they think they know everything. Everybody thinks they know everything until they don't. So sometimes you have to let them falter a little bit and recognize that and say, hey, you know, I saw this happen, you know, with this particular patient. So maybe, you know, I had a little bit more experience dealing with, you know, blah, blah, blah. So this is how you should probably approach it the next time. If it doesn't work, then, you know, hey, but usually the way I tell them to do it works. So, you know, I find that, you know, I'm kind of been insulated in my hearing, so I don't see a whole lot of that. I did when I first started practicing. I practiced at a couple of, I practiced at a local hospital that I won't name, and I practiced out in East Tennessee at another hospital. And I noticed it quite a bit, especially with the nursing staff in the way that they would approach patients. And I would make them aware. I would say, hey, look, you know, I mean, this guy has the same medical condition as this person. This woman has the same medical condition as this person. They should be treated the same way. There's no difference other than the color of their skin, and making them aware of it. And sometimes those conversations are uncomfortable. And people say, well, what are you accusing me of? And you say, I'm not accusing you of anything except ignorance. You know what I mean? You just didn't know. You know, and so I'm saying, like, just be aware that these are the same, you know, and presenting it. I have a mentor that I work with in admissions that presented 2 students the same exact way. We saw it in real time and said, this is this student, this is this student, this is what was said about this student, this is what was said about this student, which was which, you know. And, you know, when you make people aware of it, one person got mad and left the committee, and hey, that has to happen. And you know, good riddance, really. Like, that person shouldn't be on that committee, and they made that decision to leave, and that was a good thing, you know what I mean? But the others that were on the committee learned and you know, were aware of it. And so going forward, if they make the same kind of things happen, then you know that it's in their heart and not it's not there, and in their brain. It's in both places. So they're doing it intentionally, you know what I mean? So you just have to make people aware, gently, sometimes not so gently, you know, depending on, again, how much you have to lose. And, you know, I mean, sometimes, you know, I feel like depending on where I am, I have a little less cares, you know what I mean, as far as how I'm viewed professionally. So I'll say, hey, look, man, you know, this isn't right. And if y'all want to, you know, keep me around, this is what, you know, this is how you need to do. And I've never been in a position where they didn't want to keep me around because my skill set was too valuable.
Yeah.
I like that.
Yeah.
Like that. Also, for healthcare professionals, you know, I think they take you not or thinking you're not understanding. They start to talk louder and slower and repeat the same thing that they just said 10 times. Like, I can hear what you're saying. But so you talking louder and slower is not helping me to understand any better.
Yeah. You know, you have to, and again, you have to make people aware of that, you know, because they think that's an effective teaching method. A lot of times they think it's an effective teaching method. You have to say, hey, look, you know, they can hear what you're saying, but your approach to what you're not conveying what you mean to say. You know what I mean? Yeah. So, and then sometimes that takes them stepping away and having somebody else come in and say so. You know, when you're dealing with egos, again, it's hard. And you know, in certain professions in medicine, egos are even higher than, you know, like, and you have to recognize that going in and you know, depending on who I'm talking to and what field of medicine they practice, you know, I have to take a different tack. Sometimes, you know, aggression is the way to go. Like, you know, sometimes a gentler tact is more appropriate. But again, you know, for me in my position where I am, having a few years under my belt and everything like that, you know, I'm the person that has less fear about ultimately approaching that. You know, I had a colleague who I was having difficulty expressing the diagnosis that I had in mind and what I needed from that particular colleague. And this person said to me, get to the point, give me the Reader's Digest version of it. I said, oh, hold on. You know, and I started the conversation right there. I said, you know, I've been practicing for an umpteen number of years. I've been at this hospital longer than you have, as a matter of fact. So what I need for us to do is just kind of take a step back and have a conversation as peer to peer. And then I went upstairs to that person and had a face-to-face conversation with them and told them, you know, look, we need to have the same energy in person that we do on the phone, because they were very contrite in person, you know. And I say, look, we need to have that same energy. You know, I'm a physician just like you are, and I'm ultimately trying to take care of my patient the best way I know how to. So, you know, thank you for your assistance. I hope that in the future, if I have a favor to lend to you, that I'm not as rude as you were to me. and left it at that. But I feel like that was a teaching moment for that person. And it was an opportunity. So, because I feel like if they were to talk to me that way, and I'm a medical doctor, Lord knows how they're talking to the people they're training and their patients. You know what I mean? And so, and luckily for me, his outside staff heard the confrontation conversation, and they were like, "Well, thank you, Dr. Smith, for talking to him that way," because they had been suffering at his wrath, or however you want to put it. They had been dealing with him, and because of their position, they had to. You know what I mean? And so hopefully, I saw one of them earlier, and I meant to ask her, had that guy calmed down or not. But hopefully, I had a lasting impact, and he's treating people a little bit better. And that's what using your power and advocating is not. It goes recognizing it from there, recognizing that this guy is very likely to treat his African American patients dismissively, to talk down to them, to pander to them, and that behavior goes into every interaction he has with everybody. So when you can recognize that, you need to say something about it. I try to be the person to address that.
Well, look, Calvin, you have dropped some jewels on us tonight, for real, for real, for real. And what I would like to see our viewers take away from this is really, one, there is, to your point, Lee, a lot of work that still needs to be done, right? Around training. Thankfully, we have institutions like Meharry Medical College that are producing, crops and groups of these trainees and future physicians that are working to ensure that they're not carrying the same biases as maybe some of their counterparts. But the reality is like you said, you have Meharry, you have Morehouse, you have Howard, and then you have everyone else, right? And so even more of a reason why advocacy is important, because until we do get to a place of where we've broken down these systems, where we folks have been able to move past their bias, they're willing to do so, willing to work on it, you have to take your health care and have that ownership, I guess is what I'm trying to say. Mm-hmm. You have to have that ownership, because as much as Calvin is fighting, and advocating and teaching to ensure that, these future physicians are trained appropriately and in the right way, it will never be enough. Yeah. You have to own your own health care.
Yeah.
You have to own it.
Yeah. And if you can indulge me for just a second, if there are any young, like teenage Black males, females watching this, I implore you, if you have the desire to go into healthcare, don't let anybody shift your focus. Now you're gonna have to work, and on the admissions end, it makes my job a lot easier when you have good test scores and good grades. Okay, but that being said, fight for what you believe in. Don't let these counselors, anybody else tell you, especially at the stage where you are now, because it hadn't been determined yet. If you're in high school, middle school, trust me, I know people that have dropped out of high school that have gone on to be doctors. Okay, not to advocate that's the best way to go about it, because that person is the only person I know that has done it. Okay, but I say that to say there's hope for you, and if this is what you want to do, and you feel very strongly that this is your mission, then work hard to that end. And Meharry has programs in place. Howard, a lot of these places, even a lot of the North Carolina, University of North Carolina, Georgetown, have programs in place to try to help you to reach that goal. And you are needed. Patients do better when they have physicians that look like them, that come from a similar background that they come from. So I implore anybody that's listening to this that might be thinking, oh man, medicine's too tough, I can't do it, it's too long. Trust me, man, I'm doing the same things as my peers. It took me a little bit more time to get there. Yes, I can't say it didn't, but I'm here and I'm doing what I wanted to do, what I dreamed of doing, and you guys can do it. It's just a matter of perseverance and working very hard. But you are needed. You are needed. You are needed. And you have people that are going to advocate for, and it goes into the training that you guys had as well. You know what I mean? Like Black scientists, you don't have to be a physician to enact change. You don't have to be a physician to impact the healthcare of everybody around you. So, if the scientist route is the best route for you, if the dentist route is the best route for you, if the healthcare administration route is the best route for you, then pursue that. But just know that you are needed and your voice matters. And then when you get that voice, don't lose sight of where you were. You know what I mean? Always remember, I say this to myself every single day. I can see the same people coming down and I see you going up. So I try not to burn too many bridges and to be too high on my horse. Because the higher you are on that horse, if there are not people around you to help you when you fall off, you can sustain a major injury from that fall. So, you really want to be cognizant of your community and recognize the people that made sacrifices to get you where you are. And I'm glad that you guys let me say that.
Yeah.
Oh, thank you, Calvin. Thank you so much for being on the show today. It's been fantastic, actually pretty phenomenal. So
anytime you guys want me, I'm here. I can talk about anything you guys want, man. I have a lot of love for you. I remember y'all, you know what I mean, in social settings and other settings, you know what I mean. We all
cut.
Truth be told, that's what I love about situations like this is that, and Maharians in general is that, like, we care deeply about our fields of study, our passions, you know what I mean? But we also are real people too, you know what I mean?
Yes.
And we know how to let our hair down when it's appropriate, but then we also know how to pull our hair back up when we need to get in the trenches and do what we need to do too.
Yes.
So, I love y'all and thank you guys for allowing me to chit chat with y'all.
Thank you.
All right, viewers. Well, until next time, thank you for joining us for the Black Scientists Cooperative. We will see you next time. Peace.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life bright. I'm so glad that you're mine. You're mine. Yeah.